He's been part of the major group of 12 individuals who have spread a fair amount of disinformation for many years, and so including around vaccinations, and so he's not trusted.
One of Donald Trump's most controversial nominations. Well, Bobby is Robert F. Kennedy Jr., who's been nominated as the new head of the US Department of Health and Human Services. It's a position that has a broad remit across the US health industry, including food safety, pharmaceuticals, public health and vaccinations. And he would also have 80,000 employees and $1 trillion budget. Robert F. Kennedy stood as an independent in the presidential election. And he's known as somebody who, during the pandemic, was very opposed to the use of vaccines. He also has a lot of other strong views on health, including the need to remove fluoride from the water supply. And Dr. George C. Benjamin is executive director of the American Public Health Association and joins us now. Good afternoon, Dr. Benjamin.
Hi, how are you? Thanks for having me.
I'm very well. Good to have you with us. What do you make of Robert F. Kennedy's appointment?
Yeah, we're very disappointed. He is an absolutely terrible choice to be the nation's top health official. He's not got any, he's a lawyer and he doesn't have any health training whatsoever. He's never run such a big, complicated agency with such a big budget. And look, there's 30 operating divisions within that $2 trillion budget that they have. And his temperament, he's done a few things that some people would call weird. And trust, he's been part of the major group of 12 individuals who have spread a fair amount of disinformation for many years, and so including around vaccinations, and so he's not trusted. So I think he's a bad choice.
Yeah, I mean, he's well known for his views on vaccines. Do you think that could have a significant effect on confidence in vaccines? And I mean, do you fear that he might actually just cancel a lot of vaccination programs across the United States?
Well, he could try. I mean, this is, the good news is we have a lot of guardrails, but they can gum up the works. There's a lot of things that they can do in terms of appointing people to advisory committees, moving money around, not asking for appropriations for things, de-emphasizing programs, prioritizing others. And then as the Secretary of Health, he has an enormously large bullhorn. So when the secretary speaks, people listen. And so, yes, he could, as he's already done, create a lot of confusion in the marketplace for vaccines.
And do you think that could have a wider effect on global health? Because if somebody with his views is appointed to a position in authority like that, it clearly gives a huge amount of credence to what he's been saying, linking vaccines to autism and so on. Do you think that could undermine global confidence in vaccinations?
It can absolutely do so. He is our emissary to the rest of the world. He is the guy that leads a delegation to the World Health Assembly every year. He is the person that meets with the other health ministers around the world. And the fact is, his credibility as a health official has had to be stellar. And, you have many, many other health ministers that we all know. And the fact is, they're very creditable and he's not.
What about Robert F. Kennedy's views on fluoride in the water supply? He has already said in a post on social media that he'd be advising all US water systems to remove fluoride from public water. He is apparently concerned that fluoride is, according to Kennedy, linked with arthritis, bone cancer, neurodevelopment disorders, and thyroid disease.
Let me start by just saying that fluoride in our water, our public water systems, at the recommended levels, are safe and effective. And but it is a complicated issue because at higher doses, there may be some challenges that we have with that. Nonetheless, like anything, if you have too much of it, it can cause problems. But that isn't the real issue here. He can't walk in on day one and change the fluoride composition of the water, in our public water systems. And as you know, fluoride is a substance that is found naturally in water systems, which of course he does not control. So we're obviously concerned again by the bully pulpit that he can go in and try to disincentivize local communities from putting fluoride in their water. Water fluoridation is controlled at the local level. But it is big guidance, it's federal guidance. And right now, the CDC has a level and a federal guidance level that people follow, which, by the way, is actually less than the guidance that the World Health Organization uses, both of which are below the um, levels in which people think there are problems.
So, I mean, will you, as a senior official in the American Public Health Association, will you be, I mean, publicly challenging Robert F. Kennedy's views if indeed his appointment does go ahead? And we've heard that there are a few potential hurdles there. But I mean, if he is then appointed to that post, will you feel the need to actually stand up and say to people, no, I'm sorry, you shouldn't be listening to that. He's talking a load of rubbish?
We're very much focused on the public's health, and we will defend the public's health all day, every day. And by the way, we did do that during COVID when he misspoke and said things we thought were the wrong information. We refuted him. But on the other hand, obviously, when the administration, whether he's at the secretary job or not, does something that we think is good and will improve the public's health, we're ready to work with them. But when they're not, we're ready to push back on them by every tool, advocacy, letters, calls, using the courts, whatever we need to do to make sure the public is protected.
I mean, it does sound as though if he does take up this position, Robert F. Kennedy could be facing quite a battle with people like yourselves and others who are involved in trying to ensure the health of Americans.
On any given day, a health secretary in a job like that has an enormous task. We healthcare costs, opioids, obesity, sexually transmitted diseases, climate change, and all the health implications from that. He's got a lot of things on his plate to do. He's not prepared to do any of those, and that's our concern.
Just finally, I mean, one of the other things that Kennedy does seem to want to challenge is the power of the pharmaceutical industry in the United States. Do you think that that is an issue, and is that something which you'd be happy to work with him on?
Well, we do work collaboratively with a range of private sector, including industry. But let me give you an industry that we would love for him to take on. Let's let him take on the tobacco industry. We would love for him to work with us to take on the tobacco industry each and every day. They're the leading cause of preventable death, and certainly in the United States and really worldwide. Let's take on the tobacco industry. Let's get all the lead out of our water. He wants to take something out of water. Happy to work with him about getting all the lead out of our water. So we've got some things we can work with him on. He just needs to choose the right priorities.
Dr. Georges C. Benjamin, Executive Director of the American Public Health Association. Really good to speak to you. Thanks so much.
Thank you, Carol. Enjoyed it.